Hello, dear student. I am going to explain today about metabolism. Last class, I already described you about the second phase of pharmacokinetics, that was distribution. So I will request you before going through that metabolism part, I am requesting all to please go through first distribution part 1 and distribution part 2 video, so that you can better understand that metabolism process. That metabolism process is a very big chapter, so I am going to explain that thing in 3 videos. So today is the first video, that will be metabolism part 1. In that I will be briefly describe about what is metabolism, what is the importance of metabolism, what is the steps are involved, what is why metabolism is required, and which are the enzymes helping metabolism in our body of a drug, and the phases of metabolism that I am going to explain in the upcoming classes. There are generally 3 phases: phase 1, phase 2, and phase 3, that I am going to explain one by one in 3 phases. So first, today I am going to explain what is metabolism. The first thing, what is metabolism? Metabolism is a process and the third part of the pharmacokinetics. In here, when the drug is distributed through our body towards different tissues and cell and all other organs, after doing their work, they go through metabolism. That means they reaches a specific organ, generally in liver. All that process generally takes place. So what is metabolism? Metabolism is a process by which a drug generally transferred through some chemical process in different tissues of the cell. In our body, generally drugs metabolize in liver and they produce some metabolites. What is the purpose of that process? By that metabolism, they generally prepare a metabolites in which the important part will be acting for the body mechanism and body mechanism of action, and remaining part will go through different mechanism and different routes, and they will eliminate from that body, and that eliminate process also goes through in different routes. Mainly the drug go out from the body by urine, and different routes are also there, that I am going to explain in next topic when I will explain about elimination process. So now I told you what is metabolism. Now why that metabolism is important? We already know that whatever drug we are taking, if they are lipophilic in nature or lipid soluble more, then they can be distributed or absorbed more. But during metabolism or during excretion, that drugs would be hydrophilic or more hydrosoluble or more water soluble, so that they can visible to the urine water and they can excrete out through urine. So in metabolism, what we have to do, we have to convert the lipophilic, that means the lipid soluble drug that is more non-polar, we have to convert it to the polar water soluble, so that they can eliminate through the urine plus water. So to transfer that drug from lipophilic non-polar to polar hydrophilic, they goes through metabolism. Okay. Now, where that metabolism generally takes place in our body? Generally, for fast pass metabolism or fast pass drug administration, that means I already explained in administration of drug that we can take the drug through our oral routes or parenteral routes also. In oral routes, when we are taking the drug, that generally goes through GIT and they reach to stomach, then intestine. So they are called fast pass metabolism. And for parenteral drugs, they generally doesn't go through GIT, they directly mix into the blood and stay there and coming out through defined routes like sweat, then milk, air, etc. They are bypass metabolism. But generally metabolism is important for faster metabolism, that means oral drug administration. When we are taking that drug into the oral route, that drug is going through the GIT tract. Through the GIT tract to esophagus, they reach to stomach, and then they transfer to intestine. And during that whole process, the drug generally got metabolized into a different part or different organs of the body. But most of the drug, almost 80 to 90% of the drug got metabolized in liver. Through a enzyme, different enzymes are present in the liver, which generally help liver to metabolize different types of drugs. Except liver, different organs are also there which helps in metabolism, but very minor quantity. But most of the liver do that metabolism. Other who are helping in metabolism, they are kidney, large intestine, or we call it gut mucosa, and some of the drug which we are taking through the parenterals, that can be metabolized by skin. So now we have to study what are the steps of metabolites and what are the types of metabolism. So for that we have to study 3 steps or 3 processes. The first process of metabolism or first step is conversion of active drug. First one is conversion of active drug to the inactive metabolites. In that process, what happens? In that process, the drug is generally taken by oral route of administration. That means first was metabolism. So the drug will take through oral, then it will go to GIT, then stomach, then intestine. Before that, that will go to liver, and that liver metabolism will take place. In that metabolism, different phases are there. They will go through the phase 1, phase 2. Like oxidation are there, hydrolysis is there, racemization is there, cyclization is there. All that I will going to explain in different metabolism phases. So just remember, different phases are there. In phases, that drug will go through metabolism in liver. After going to metabolism, they generally produce inactive metabolites which don't have any action to our body. So they mix to urine and they excreted through that urine. So that is the first thing. Example of different drugs, we generally go through that mechanism of active drug to inactive metabolites. Are example I am telling propranolol. That drug I already told in previous classes. Propranolol is a drug that is anti-hypertensive, that is beta blockers. We will study later what are the propranolol, everything we will discuss later. Then the second thing is paracetamol, that we generally use in our daily life. We know that is analgesic, antipyretic. All that drugs we use here, that is paracetamol. And that third drug which goes through that phase, that is lidocaine. Lidocaine is used as anesthetic. That means we use that before different surgery work, so that they go to senseless. For that we generally use anesthetic, that can be local or that can be generalized. One of the example is lidocaine. The second step is, first step I already discussed, that is conversion of active drug to the inactive metabolite. The second thing that is the important and that is the most of the metabolism that takes place in our body for most of the drug, that is conversion of active drug to the active metabolites. That is the main process of the metabolism. Most of the drug and most of the things going through that phase of metabolism. That is generally 2 phases. That is phase 1, phase 2. In phase 1, 2 things are there. One is oxidation, second one is reduction, third one is hydrolysis. and in that two things are there, like a glucoprotein alkylation, acylation, all these things process are there. I have already told and started in the class that that is the main part of the metabolism, and you have to understand that is better thing to understand the remaining process of the metabolism. So that phases are very large topic that I am going to explain in the next upcoming two part of the metabolism. So just remember and tell me to describe that process, because that is the most important and I need some time to explain. So I will explain that into the next video. So I am going to the third process of metabolism that I am going to explain today. That thing I will explain next day in next upcoming part of the videos. So the third process of metabolism is conversion of inactive drugs to the active metabolites. These are the drugs which are inactive in nature, and they are inactive means they don't have any action, but after reaching into the body they go through different metabolism phase, and they goes through metabolism in liver, and after metabolism different enzymes helps in metabolism of that drug, and it's converted to its active form or active metabolite form that is going through different tissues and different cells of the body, and that active metabolites is going to show different types of mechanism or different of mechanism of action for which we are going to take that drug in our body. Those type of drug is called prodrug. So what is prodrug? Prodrug is a inactive drug which don't have any action by its own. They go through different metabolism by enzymatic action, and after going through enzymatic action they convert to active metabolites which have active form, and they have main mechanism of action, and they reach to different tissue and they shows their action. This type of drug go through the third step of metabolism, that is inactive drug conversion to the active metabolites. Some of the example of products which go through that type of metabolism. The first example is dopamine. Dopamine is a drug that is the active form of the drug which are generally used to treat Parkinsonism. Parkinsonism is a disease in that dopamine deficiency is there in our body, so it will create different seizures and different memory related problems that we are going through in next classes when we will go through Parkinson disease and their treatment. That time we will study. Now we have to just remember metabolism drug is dopamine. That is, the dopamine is the active form of drug, but we can't take it in our body as our active form. So we have to take inactive form of dopamine, and after taking that dopamine, inactive form of dopamine, they will go through enzymatic action into the liver, and they going to transfer into the active form of dopamine, and they will show its action in treating Parkinsonism. So the inactive form which we are going to take in our body as the active form, that is levodopa. So levodopa is the inactive form or the prodrug which we are going to take as an inactive form. Then it will go through enzymatic activity and it will transfer into the dopamine which has the active form of the levodopa, and it will going to show its action to treat Parkinson, the disease. The second option or second example of product that is going through that third phase of metabolism or the third type of metabolism is valcyclovir. That is the inactive form or product. We don't have any action by its own. So after taking it into the body, after enzymatic activity of metabolism, it is going to convert into the active form of the, that is acyclovir. That acyclovir is going to treat the main disease. For that we are taking the drug. Acyclovir is generally used to treat viral infections. So acyclovir is an example of antiviral drug. So that is the active form which we are going to take to treat antiviral as a antiviral to treat viral infection, but that is in a active form of drug that we can't take directly as a active form. So we have to take inactive form of that acyclovir, that is in a valcyclovir, that is inactive form of acyclovir. That is an example of product which is going through metabolism by third phase or third type of metabolism. Now I am going to explain in short detail what are the enzymes and what is the main enzymes present in the liver which are responsible for the metabolism. So enzymes. So I already have told you that most of the drug got metabolized in liver, and I in previous different methods and different type I already added one word, that is enzyme. That means enzyme is the main thing, or enzyme is one of the important component that is required in all of the chemical process that is going through in our body. What is enzyme? Enzyme is like biological catalyst. We know what is the catalyst. Catalyst is a chemical which is generally present in a reaction, which generally speed up that speed or rate of the reaction but never participate in that reaction, and they form unchanged after that reaction also. So their main work not to participate in reaction, their main thing is they have to just speed up any reaction. So here also in metabolism, liver generally works as a metabolism part and different gastric acid help and to speed up that metabolism speed so that that drugs can be metabolized very fast or in a rapid form. So different enzymes helps in as a biocatalyst. So here in metabolism, the main enzyme which helps, that is cytochrome P450. That is the main enzyme present in the liver which are responsible for the metabolism, to speed up the metabolism process in the liver. So that cytochrome is present in different part of the liver, and according to that different location of the liver, there are mainly 74 types of cytochrome P450 present in the liver which are going to help in the metabolism of different drugs in liver. So there are 74, but out of that 74, generally 3 types of cytochrome P450 is there which are generally or mainly responsible for the metabolism of the drug, and they are also classified or named according to the location of the enzyme where it is present in the liver. The first type of cytochrome P450 according to the location in the liver, that is microsomal cytochrome P450. By that name only you can easily understand that cytochrome P450 is present in the microsome part of the liver. So that is present in the microsome part of liver. By that name only you can easily understand. And the second type of according to the location is, that is non-microsomal. That means that they are not present in the microsomes of liver, they are present in the non-microsomal part. They are present generally in the cytoplasm of that liver, or other else they can present in the mitochondria. And hemopoietic, hemo means we already know that is blood. In blood they are present. That types of cytochrome P450 is called as hemopoietic cytochrome P450. All that enzymes are the important enzymes which are going to explain or which are going to help in the metabolism process. So by that I have completed the small introduction about metabolism. So most of the metabolism part is covered about its G's, how it is working, what is metabolism, what is the types of metabolism, where it is going to take place, what are the enzymes helps in metabolism. Now the next and main part is metabolism phases, different phases, how that drug is going to metabolize in the liver. That phases are generally 2 types, phase 1 and phase 2, and they are very important for the metabolism and for the remaining part of the drugs which are going to explain later. All that phases are very vast and very important to understand. So I am thinking to explain all that phases in different part of the videos slowly so that you can understand all that phases very easily. So in that next video we are going to explain the different phases by which the drug takes place metabolism in our body, and especially in part 2 we will discuss about only phase 1, and in part 3 video I will explain about phase 2 or last phase of metabolism process in the part 3 video. So I will request you to follow whatever I told you today in metabolism part, and check my other videos of absorption, distribution, what I already covered. Thank you.